Could your morning routine be setting you up for kidney stones? Let's find out what seemingly harmless habits could lead you down a painful path. Kidney stones, or renal calculi, are hard deposits made of minerals and salts that form inside your kidneys. Despite their small size, they can cause excruciating pain as they pass through the urinary tract. The formation of kidney stones is primarily influenced by dehydration. When the body lacks sufficient water, urine becomes concentrated with higher levels of minerals and salts, which can crystallize and initiate stone formation. In the intricate balance of body chemistry, dietary choices cast a long shadow over the risk of developing kidney stones. Consuming excessive amounts of sodium is a common pitfall. It doesn't just raise blood pressure, but also increases the amount of calcium in the urine. High calcium levels can join with oxalate or phosphate and start to crystallize, forming the dreaded kidney stones. It's not just about table salt. Processed foods, canned soups, and ready meals are often loaded with sodium, quietly contributing to the risk. Similarly, foods high in oxalate, such as spinach, beets, nuts, and tea, can exacerbate the formation of calcium oxalate stones when consumed in large quantities. While these foods are generally healthy, moderation is key for those susceptible to stone formation. On the other end of the dietary spectrum, high protein intake, particularly from animal sources, increases uric acid and can lower urine pH, leading to uric acid stones. These dietary habits create an environment in your kidneys where stones are more likely to form. Moreover, insufficient calcium intake can paradoxically lead to more stones, contrary to what one might expect. Dietary calcium binds with oxalate in the intestines, reducing oxalate absorption and its concentration in urine. Without enough dietary calcium, oxalate finds its way into the kidneys, where it can contribute to stone formation. Beyond dietary factors, genetics and certain health conditions significantly influence the likelihood of developing kidney stones. Genetic predispositions can affect how an individual's body handles minerals such as calcium and oxalate. For instance, some people may have a natural tendency to excrete more calcium in their urine, a condition known as hypercalciuria, which markedly increases the risk of calcium stone formation. Familial histories of kidney stones often suggest a genetic component, indicating that if your parents or siblings have had stones, your risk may be elevated as well. Medical conditions also play a pivotal role. Obesity, for example, has been linked to an increased risk of forming kidney stones. The mechanics are multifaceted, but include increased insulin resistance and changes in the way calcium and other substances are processed in the body, leading to a higher incidence of stone formation. Diabetes similarly affects kidney stone risk through alterations in urine pH and the excretion of various stone-forming substances. Furthermore, digestive diseases like Crohn's disease or surgical interventions such as gastric bypass surgery can alter the absorption of water and minerals, thereby increasing stone risks by changing the urinary and intestinal environments. Additionally, metabolic disorders that affect how the body processes certain chemicals can lead to increased stone formation. Conditions like renal tubular acidosis, cystinuria, and hyperoxaluria disrupt the balance of urine pH, or increase the levels of stone-forming substances in the urine. These disorders not only predispose individuals to kidney stones, but also make management and prevention more challenging. Prevention focuses on lifestyle adjustments. Staying well hydrated is paramount. Drinking enough water dilutes the substances in urine that lead to stones. A balanced diet low in sodium and oxalate, combined with an appropriate intake of calcium, helps prevent the most common types of stones. For those at higher risk, medications might be necessary to manage mineral levels in the urine effectively. Understanding these factors allows individuals to take proactive steps towards preventing kidney stones, reducing both their frequency and severity. Through dietary management, adequate hydration, and understanding personal health risks, one can significantly mitigate the risk of developing kidney stones.